This patient presents both convexity at the level of the nasolabial fold and a wrinkle in the middle of it. The technique which will be used for carrying out the treatment is called a sandwich. It is the continuous method with a reduced flow of the AIS injection system which has been selected in combination with the Fortelis extra gel. As with any injection with a blunt cannula, an opening should first be made with the needle, which will allow for the introduction of the cannula into the dermis. First introduce the cannula almost perpendicular to the cutaneous plane. Then, with the extremity at the junction of the dermis and the hypodermis, continue its deep insertion for its full length until the base of the nose has been reached. Check the position of the cannula by palpation. At the end of each line of deposited gel, while the cannula has almost fully emerged from the dermis, change the directional angle of the cannula so as to cover the entire area in a fan shape. After the injection of the first fold, we see the volumizing effect provided by the product, and the absence of dermal trauma thanks to the combined use of a cannula and the AIS injection system. Continue the treatment following the so-called blanching technique with the injection of the Esthelis basic gel, known for its cohesive qualities and its perfect biointegration. Insert the needle as parallel to the cutaneous plane as possible so that the injection can be made in the superficial dermis. The position of the needle can be controlled by transparency as well as the appropriate injection of the gel through the progressive whitening of the treated area. The whitening will disappear after a few minutes and leave an extremely natural result.